Hello and welcome to Dr. Zarin's psychology classes. I am Dr. Zarin Sethna. I am a clinical psychologist and associate professor and head of the Department of Psychology. Psychology is a science of behavior. But in order to understand the behavior, we need to understand the functioning of our body. In today's video, we shall try to understand the working of a nervous system. Our entire body is covered with numerous nerves, and these nerves are like the highway carrying messages from one part of our body to another part. Since we have meters and meters of nerves, in order to understand the nervous system, we need to divide it into various categories. The two major categories of the nervous system are the central nervous system and the peripheral nervous system. Central nervous system is made up of brain and spinal cord. The word central means two things. One, it is important, and second, it is in the middle. And that's exactly what central nervous system is all about. Our brain and spinal cord are the most important parts of our body, and they are also in the center of our body. We shall talk in detail about the brain and spinal cord in the later videos. Today, we shall only concentrate on the various categories of the nervous system. If you leave out the brain and spinal cord, then the rest of the body comes under peripheral nervous system. The word peripheral comes from the word periphery, which means sideways, and therefore the rest of our body is covered with peripheral nervous system. Peripheral nervous system is further divided into somatic and autonomic nervous system. The word somatic comes from the word soma, which means body in Greek. Somatic nervous system is further divided into sensory nervous system and motor nervous system. Sensory nervous system, as the name suggests, is made up of our sense organs, namely eyes, ears, nose, tongue and skin. All the information and all the knowledge that we have about the world around us comes to us from our sense organs. So for example, your eyes capture the picture of an object in front of you, and then the sensory nervous system carries this message to the brain. Your ears collect the sound from around you, and the sensory nervous system carry that message to the brain. If there is a mosquito biting your skin, the sensory nervous system catches that message and sends it to your brain. What does your brain do with all this information? Your brain understands and tries to make sense of all this information. Our sense organs can only collect information, but our sense organs cannot understand that information. Understanding is the job of the brain. So when you see your mother in front of you, your eyes will only collect the picture of your mother. But when sensory nervous system takes that message to the brain, your brain helps you to recognize that she is your mother. Your brain tells you that she is calling out your name. Your brain tells you that there is a mosquito biting and it needs to be removed. Once the brain has finished its job of understanding the message, then what will it do? Then it has to send the orders down, and this happens with the help of motor nervous system. In psychology, when we use the word motor, we actually mean muscles. Our entire body is covered with muscles, and it's because of muscles that we get all our work done. So when the brain understands the messages it has received, it sends the orders down. And therefore the brain helps you to hit that mosquito and shoo it away. Your brain helps you to turn around when somebody calls you out from behind. So our brain gives orders to our body, and this orders reaches our body with the help of motor nervous system. So this is how sensory nervous system carry the message up towards the brain, and motor nervous system carries the order down from the brain to the rest of our body. Another important category of our nervous system is what we call as autonomous nervous system. This is one of the most interesting, and for psychology students, one of the most important set of nervous system. The word autonomic comes from the word automatic, and therefore autonomic nervous system consists of those organs on which we have very little or no control. Autonomic nervous system once again is divided into two subcategories, the sympathetic nervous system and the parasympathetic nervous system. Sympathetic nervous system is responsible for producing excitement and arousal in our body. Why do we need this excitement? We need this excitement and arousal during times of emergency. For example, suppose you reach the railway platform and you realize that your train is just about to leave. If you run a little, you'll probably be able to catch the train. You're walking on the road and there is a dog chasing you, and now you have to protect yourself from your dog. You pick up your phone, and from the other end the message comes that you have topped university. In all these examples, your body is now going to produce excitement and arousal. So what will it do? Your heart starts beating faster and pumping out blood rapidly, so that now there is extra flow of blood in your body muscles. Because your body muscles require more blood, all the blood from below the skin of your face will be drained away and sucked up by the muscles. And therefore, our face becomes pale or dull or ash. And the temperature will go down, skin will feel cold, and there will be perspiration. Our eye pupils will dilate because at this moment, you need to see the world clearly around you. Our mouth will open and will breathe in heavily because at this moment, we need extra oxygen to give us extra energy. There are many things that are happening within us which we don't realize, like for example, our liver will now start producing extra sugar, and therefore temporarily our blood sugar level goes up. Sugar, as you know, gives us instant energy. So what sympathetic nervous system has done is, it has produced various changes in our body which will in turn give you excitement and arousal. And this excitement now helps you to run and catch that train. This energy in your muscles will now help you to run away from that dog and protect yourself. This extra arousal in your body will now help you to jump and scream when you receive the good news of you having topped the university. What happens after you have caught the train? What happens after you are now safe in a corner and the dog is far away? What happens after all the jumping and screaming for a few seconds? After that, your body starts cooling down. So you'll probably search for a place and sit down. You'll probably take a few sips of water, and within a few seconds or maybe within a few minutes, you'll realize that your breathing is now slowly settling down. Your heartbeats are lowering. Your skin gets back its color very slowly. Your pupils are now coming back to its normal size. Internally, our blood sugar level again starts dropping and normalizes. So your body now slowly starts coming back to its normal level of functioning. This happens with the help of parasympathetic nervous system. The job of the parasympathetic nervous system is to regulate and bring our body back down to normal functioning levels. Why? Why is it necessary to bring your body back down to normal levels? That's because this extra excitement and arousal may be good for a few seconds during that period of excitement or emergency. But if your body remains in that state for a very long time, body damage begins. For example, if your heart continues to beat out at that rate, it might lead to heart attack. If your eyes remain dilated for a very long time, it might lead to damage of tissues. So it's not healthy for your body organs to remain in an excited state for a very long time. And therefore, our autonomic nervous system works beautifully. The moment you have an event of excitement or arousal, your sympathetic nervous system helps your body to fight or flee with that particular situation. But very rapidly, right behind it, parasympathetic nervous system takes over, and now it tries to cool down your body so that it protects you from organ damage and you come back to your normal functioning level. This, in short, is our entire nervous system. To see many videos of such related topics, please subscribe to my channel and do not forget to ring the bell icon. Thank you and have a happy day.